CARMMA as a campaign has been insisting that we should not reduce women's health to just mere hospitals and clinics and health workers. It has got to do with you and me. It has got to do with how men see women within our society. If women are equal in our societies and they can exercise their rights in the same way as anybody else can, I am sure we would not sit with maternal mortality. Unfortunately, only women give birth. Only women are experiencing this, and therefore I want to believe that if we want to make a change, men have to accept responsibility as well. It is about our culture, it is about our religion, it's about how society looks at us. And I am one of those that will continue to advocate for gender equality, for education for women and empowerment for women. Because you and I can today negotiate how many women and girls that are sitting in the remotest areas in our countries without education, without empowerment, will continue to have children and will continue to put themselves at risk for having more and more children. We were talking about girls that marry too early. I cannot believe that a girl that is 10 years old or 12 years old can truly be a mother, not just physically, but also mentally and otherwise. And I think those are the practices that we should fight against, because they are not good for girls and they are not good for women. We launched the campaign CARMMA in 2009 when there were all the ministers of health of Africa present. And we told them that once they launch CARMMA, they have to be committed to make a change. 2015, we have to show that we can reduce maternal mortality. And so the campaign is really about raising awareness, about talking to our political leadership to take the issue more seriously than they have done so far. During this conference, we will also be listening to participants that will be talking about what their experiences had been since they launched CARMMA. And I was so proud sitting there and listening to countries that says, since we launched CARMMA, governments have allocated funds to maternal health. Since we launched CARMMA, we had a much better coordination. Since we launched CARMMA, we have involved the community. So it's only 2 years, 3 years, we have got 35 countries with Tunisia that has launched CARMMA. It is not, as I always want to say, it is not a new strategy. It is about Africa saying we want to take ownership over our problems and also find solutions. So being in Tunisia and witnessing the launch of CARMMA was in fact something we decided in 2009, that we want to launch CARMMA in Tunisia, bring everyone together here so that we can talk and share experiences. And I can assure you, when we leave from Tunisia, all of us would be better equipped to resolve to do it. And there are countries that are already showing progress. So by 2015, if you ask me this question again, I will be able to say we have been successful in reducing maternal mortality in Africa. Well, as we have said, there are many causes of maternal death. And some of them will require medical intervention. In other words, when women are, for example, dying as a result of bleeding, or when they cannot give birth normally, they would need to have emergency treatment, etc. Those are the medical interventions. We need to improve that. We need more skilled birth attendants, health workers, because in many cases that is a big problem, and that is that we do not have enough midwives, we do not have enough nurses to attend to people. That's the medical side. We also need to really talk a lot about sexual and reproductive health issues. Some governments shy away from it because they do not want to address issues of sexuality of women. But that lies the crux of the matter. The fact that we do not have always enough skilled health attendants. It's attitudes within our society. And as I said, when we have to discuss sexual and reproductive health of women and of girls, because if we do not do that, we cannot prevent because we should not wait until it happens. We can prevent it by providing people with family planning education, by providing them with the contraceptives they need. Because at the end of the day, I don't think every woman wants 10 children. I hope no men think that they also need to have 10 children. So if we can really give women the choices to have fewer children, that also assist them to become more productive within their societies. Because by giving birth every year, you cannot see yourself as being productive in the sense that you participate in the lives within your country. We need to increase education amongst women, because it's through education that women can negotiate. It's about power, isn't it, at the end of the day, between men and women. And we need to claim our power in society and make sure that we can live better lives for ourselves and for our children. We need to get men involved. We do not hate men. We also do not want to be equal to men. We want women and men to be equal to each other. In other words, the standard that we are looking at is a human rights standard, where all of us are human and that our dignity is respected. So men need to get involved, and they also need to understand that they have a role to play in reducing maternal mortality. It's not a women's issue. It's for everybody in Tunisia and in Africa to be involved.